Fala YouTube, beleza? Nada Games aqui pra mais um vídeo. Bom galera, vocês lembram do último vídeo, né? Que era o arrumando o dente. Aqui estamos em outra versão e vamos nesse Go. Vamos lá, vamos puxar isso aqui. Forte. Estamos naquele mesmo jogo, lembram? Que tinha que arrumar o dente, pá, isso daqui tem que arrumar a mão, eu acho. A mão não. Aquele negócio lá. Esqueci. Como eu esqueci? Como você é burra, né?
Hello, and welcome to Surgery Squad's
Vai começar de
virtual
volta.
adnodectomy. I'm Dr. Susie, and I'll be guiding you through
Vou
this
ficar
procedure
quieto
today.
aqui.
Our adenoids are located at the back of the throat, just below where the nose connects,
Por
also
uma
known as the
parte,
pharyngeal tonsil.
né?
They are
Então
part of our
vamos aí,
immune
então.
system because they protect us from the
Eu posso falar
bacteria
agora
or
que eu não tô
viruses that might
interrompendo.
enter the body when we breathe or swallow. They are more important for children than adults, and they shrink as we get older. In some adults, they become inflamed,
Não tem como pular isso.
which can lead to infections, sleep apnea,
Não tem
better
como
known as
pular.
snoring, and ear infections, since enlarged adenoids might block the
Então,
eustachian
pra baixo,
tubes,
pra baixo.
which drain fluid from the ears into the throat. Normally, these symptoms can be treated with antibiotics.
É, eu lembro
But
do
when these
dente,
infections
mas
occur
não
more
tem como
frequently,
editar ele,
we
porque
perform an
isso aí,
adenoidectomy to remove them.
E agora?
Having an adenoidectomy, if it is required, can reduce the number of ear infections, reduce recurring chances of sinusitis, and can alleviate sleep apnea. However, there's a risk of developing an infection at the removal site.
Vamos
Plus,
logo.
the procedure might
Eu
not
tô falando
alleviate
meio
all the
baixo,
problems
acho que tô
associated with
falando meio baixo,
adenoids.
né?
For instance, if
Todos
ear
os dias eu tô
infections
falando meio
continue,
baixo.
the problem might be elsewhere. Our patient today experiences sleep apnea and ear infections.
Nossa, tá bom,
Let's
tá bom,
scrub
tá
in
bom,
and
tá
get
bom,
to
tá
work.
bom, tá bom, tá bom, tá
We'll
bom,
need
tá
to
bom.
use a general anesthetic for our patient. Why don't you help out? Can you find a suitable vein in the patient's
Tá,
hand? Looks
tem
good
que
to me.
ficar na veia.
Sterilize the injection area using a sterile alcohol.
O que vamos fazer ali?
Insert the needle and advance the angiocatheter into the vein.
Ai,
The small burst of blood in the angiocatheter hub is what medical professionals refer to as a flashback. This lets us know that the angiocatheter is correctly positioned in the patient's vein. While placing a small amount of pressure over the vein to collapse it, remove the needle. This will reduce the amount of blood that may discharge out of the angiocatheter when the needle is removed. Now that the needle has been removed, I'll dispose of it in a sharps container. We need to secure the IV with tape and test the line. Great! Now we'll wait a few minutes for the anesthetic to take effect.
3 minutos depois.
One more
2,
thing.
3,
Since we'll be working in the patient's nose and mouth area, we'll need to make sure he can breathe. Let's insert a breathing tube into one nostril.
Ai. Nossa.
Great job! Our patient is under and breathing. Now we're ready to remove the adenoids. We'll begin by putting an endoscope through our patient's nose so that we can view our work on a monitor. When we reach the back of the nose at the entrance to the throat, we'll be able to see the adenoids. Okay, good. Now we can see the adenoids. We need to open the mouth and get the tongue out of the way so we can begin our procedure. To do that, we'll use a special retractor that opens the mouth, depresses the tongue, and locks into position.
Isso daqui entra na boca.
Great work! We're going to remove the adenoids using a device that uses suction cautery. The device uses electrical pulses to liquefy the adenoid, then suctions the liquefied adenoid.
Que dor. Que dor é essa? Meu Deus, que dor é essa, gente? Dor, cara do céu, que dor. Acabou. Aí.
Fantastic! The adenoids are gone. Now all we have to do is remove all of our equipment and get our patient to recovery.
What?
Our patient is in recovery, and he'll be able to go home in a few hours once he can breathe easily, cough, and swallow. We'll prescribe some antibiotics, and once he gets home, he needs to drink plenty of water to keep hydrated. He'll also need to stay away from solid foods, but he'll get to eat ice cream, sherbet, popsicles, and jello for a couple of days. He might experience a burned taste in his mouth, which will subside after a couple of days. He should brush his teeth often to help alleviate that taste. Scabs might form in the back of his throat from the surgery, and, of course, he should contact his doctor if there's bleeding or excessive pain from where the adenoids were removed. You did a great job today. Try your hand at one of our other surgeries here at surgerysquad.com.
Vamos fazer mais um. Deixa eu ver quanto tempo tá o vídeo. Tá sabendo, vamos fazer mais um. Tô arrumando meu relógio aqui. Aí, gosto que eu fiquei sem falar, esqueci que tá fazendo vídeo.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I'll be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one. Our patient is ready, so let's begin by disinfecting the toe.
Tá enxadão aqui. Vamos fazer pra ele.
Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Deixa eu chutar o chão.
Great. Now we'll wait a few minutes for the toe to get numb.
1, 2, 3, 4, 5. 2 minutos depois.
Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. First, carefully slide one blade of the nail anvil under the affected. We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown.
Caralho, véi! Meu Deus!
Great. Take the forceps and carefully remove the ingrown nail. It's getting kind of messy in there. Let's clean up that blood. See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to get as much of that infection out as you can. That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Meu Deus.
Finish by applying some antibiotic ointment on a sterile. Place it against the toe and wrap it in a gauze bandage.
Acabou, né? Deixa eu ver a continuação do vídeo.
Fantastic job!
10 minutos.
Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics.
Tá.
We'll also need to tell our patient to keep the wound dry, clean the
galera,
wound regularly,
esse foi o vídeo,
and
espero que
replace the
tenham
bandage
gostado.
2 to 3 times a day.
Arrumando na boca.
While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry.
Até o próximo
And
vídeo.
that's how we remove an ingrown toenail.
Fui.
You did a great